10 minutes. First of all, Mr. Gouderian and then Mr. Staal. Mr. Gouderian, please, you have the floor. And then after the two introductions, we can go to the Q&A with the members. Please.
Thank you, President, and thank you for the invitation, and also nice to see a number of MEPs with whom we have been working over the last couple of months, almost 2 years, on the issue of COVID-19. First, EPSU. EPSU is the European Federation of Public Service Trade Unions. We represent 8 million workers in public services across Europe, and most of those workers have been fully involved during the pandemic. They had to work and they had to deliver public services. Think of prison guards, think of firefighters, think of workers in the utilities, delivering your water, your electricity, collecting your waste, and also think of those workers in central government administrations who had to deliver the programs to bring money to citizens, money to businesses during the periods of lockout. But first and foremost, of course, the workers in health and social services. And before starting, I think we can pay tribute to those workers for the work they did during the pandemic. I think we have all seen the images on television. Hospitals which were overwhelmed with patients and workers who didn't know much about the health and care workers which didn't know much about the disease, but still had to take care in residential care, in home care, and, as you know, often unprotected in the beginning. EPSU is the European representative organization representing those workers. And that straight away will be one of the main messages of my contribution, is that we should not forget to put those people who deliver care and other public services, who take care of us 24 hours a day, 7 days a week, 365 days a year, to put them in the middle, center stage of the work we do, and I hope also in the work the committee does. As was already remarked, many of those women in care are women. Just to remind us, tomorrow is Equal Pay Day in the European Union, where we will draw attention to the fact that many women still earn on average less than men, and that is certainly also due for a large part to the low pay of women in the care sector. EPSU, ETUC, Klaus Michael, and the World Health Organization's Pan-European Commission on Health and Sustainable Development have stated that we need to address the deep-seated health, social, economic and gender inequalities exposed by the pandemic. And once again, I think Mrs. Verbove earlier in the session with the ILO raised some of those points as well. The Pan-European Commission has drawn attention to the large inequalities in wealth and in income inequality, the underinvestment in social protection. Mrs. Verbove stressed that a moment ago as contributing to the big disparities in inequality in Europe. And the Commission recommends that we address that. I think this also addresses what many trade unions, NGOs, and I think also many of you here in this House, if you call this House, have addressed. And I think it's worthwhile to look at those recommendations of this Pan-European Commission and possibly include them in your report. The second message, I would say, links very much to that, to acknowledge and address the severity of staffing shortages we have currently in health and in social care. We do know, and I think you do know, that this leads to so-called medical deserts in the European Union. It leads to situations in which people cannot exert their right to health and care. And, I think important, it leads also to more expensive solutions through agency work, for example, to address those those staffing shortages. It's far cheaper to train people than to employ agencies to engage people. So the lack of staff, of course, is mirroring the lack of respect for the work health and care workers do, and the lack of good conditions. And we think this is now a societal issue which also needs collective approaches. And that leads me to a third point. The pandemic, we think, has shown that we need to be prepared, and that preparedness rests on robust, resilient and equipped public services and social protection systems. And I can fully agree with Mrs. Verboven, what she mentioned earlier in her session, the importance of well-developed social protection systems. Obviously, that means public investment and public funding. The Pan-European Commission I referred to earlier calls on countries to address these long-standing gaps in funding in primary care, in mental care. A number of you raised that issue as well as in social care, and while investing and protecting the healthcare workforce. EPSU is a member of the ETUC, the European Trade Union Confederation, and my colleague and friend Klaus Meijker will address in a moment some of the more general labour market issues. We are very much appreciating the European Parliament for setting up this COVID committee. Maybe some of you remember that together with the European Disability Forum and AIDS, which is the European Organisation for the elderly, we called upon the Commission on the Parliament to set up an investigative commission, because in June 2020 we already saw the immense impact this crisis was having on many people, not least on the elderly, not least on people with disabilities, and the workforce who was dealing with this. So we are very pleased with this COVID committee. We heard recently you extended the mandate to another 3 months for this committee. It's not yet done?
We asked for an extension, but we'll get it. Don't
well,
worry.
Anyway, you have our support for that extension if you need it. You can at least say trade unions are supporting that extension of the mandate, because we do think it is very important to go as far as you can go investigating this, and we look very much forward to your recommendations. For us as healthcare workers, you might remember already one of the first reports of Amnesty International in 2020, I think it was in September, indicated several thousands health and care workers died. So going to the bottom of what went wrong, how these workers were not prepared, we think is very much is very important. Within the trade unions, we advocate for a one health or a one team approach, not only looking at doctors and nurses, but also at the cleaner and other people, medical, paramedical staff in hospitals and care homes, and our preparedness has to cover all those workers. I was looking for the clock, how much time I still have. So preparedness is very important for all of the workers involved. Some of you were present at a meeting we organized in September here in the House with a number of you, in which we had testimonies of health and care workers. And I think President, you were present at part of that as well as some other members here. And I think the testimony of those workers is heart-wrenching, I think is the English word. I mean, it knocks you over. One of the testimonies of a nurse, a Czech nurse, who was arguing, who was making the point that she was coming home to have to take care for her elderly mother because the services were no longer available, infected her mother who died, and she still had to go back to work in the hospital with being infected herself, even although she was, how do you call it, asymptomatic and not didn't show the symptoms, and still she was called to work. So there are many testimonies like this, and we certainly would welcome to bring those care workers to this House from across the European Union and assist the COVID committee in listening to them. Think of it, if you have another 3 months, Chair and members of the committee, think of it on the 11th and 12th of March, we celebrate it's not the right word. We remember 3 years of the COVID pandemic, the lockdown, especially here in Belgium and other countries. And I think it would be an excellent moment to also listen to them, how after 3 years they are experiencing the situation. And we certainly are in a position to help you bring that representative voice. One or two other points to end. We find the European Health Union itself is not very strong with regard to the element of planning for staff shortages. We think that is neglected in the European Health Union. Unions are not part of the consultation mechanisms of the various bodies we have now set up. And now you might say, well, unions again. But the employers are not there either. So the social partners are not involved. And I think it is important for employers and trade unions to take the measures which are needed in the sector and to roll them out. Lack of staffing. This House is going to look, I think, also at the mental health strategy proposed by the European Commission. There's not a single word about the lack of staffing in that mental health strategy. I mean, we assume that the workers are there, but they are not there. The mental care nurse or the mental care doctor and all the supporting services, they are not there. And I think it is important to address that. I think a speaker in one of the questions, I think Mr. Kim Pouropoulos raised the issue in his questions about the stress at work for many people. And I think these sort of issues need to be addressed when we talk about a mental health strategy as well. A last point, and I think I've then exceeded my time. We are, as trade unions and employers, lacking a continuous dialogue with DG Health. We don't have a continuous dialogue on many of these issues which are addressed. It's a little bit better with regard to the European Care Strategy, which I hope many points of this you will integrate in your work as well. But we lack that continuous dialogue with the DG responsible for health. That's one of the reasons why on the 9th of December, and if you're around, please come, we will be organizing a demonstration, a rally, before the Health Council, the Health Ministers' Council, to make this point. We need more staffing, we need finance, we need to address pay and conditions of healthcare workers, and we need that social dialogue with also the European Commission. So, we need a response that covers all workers. We need to put workers central stage. And if we want a sector that is attractive for people to work in, so we can address staffing issues, we need to ensure that this sector is offering decent pay and conditions.
Thank you very much, Mr. Goudriaan. The things that you mentioned about the medical desert, was something that already was already something that was there before the crisis, of course. It just been strengthened and became very outspoken during the crisis, and it's still there after the crisis. But I think it's very important that you stress that. And the second point that I want to stress as well, before I give the floor to Mr. Staal, is what you said about testimonies. And we'll come back in this committee also on the feedback on the mission to Italy. But in Italy, in the mission there, we had a lot of testimonies of healthcare workers, people in hospitals, the Red Cross, and I agree, this pandemic is not just about facts and figures, but also about what really happened over there and how we take that lessons on board. Mr. Staal, you have the floor.
Thank you very much, and let me start by thanking the committee for arranging this hearing today, because there are many reasons to discuss the lessons learned, and it's important to discuss what can be done to avoid and repeat mistakes in the future if another pandemic or another crisis arises. And the fight against COVID-19, in particular the early period, was certainly a mix of setbacks, but also of success stories. And the dilemmas of collective actions can be difficult. The basic question was, as always in times of crisis, are we going to act jointly and together, or is it each and everyone on their own? Is it collective action or individual action? And I'm representing the ETUC here today, and it is an organization that was very involved with its affiliates during this period. We faced a number of questions and concerns that we tried to tackle jointly. And we did it through briefing notes, and we tried to create a system of exchange of information and experiences on how to tackle issues that arise. And I would invite you actually to go through our briefing notes that we prepared with affiliates, because they give a very good understanding of the issues that arise during the pandemic, step by step. And there are almost, I would say, an infinite number of issues to raise, and John Willem has addressed some of them, and I will focus on some other ones, but of course it's not going to be covering all the aspects that one would like to discuss in a hearing like this. But so here are at least three things that I would like to mention for of importance for the EU level. And the first one is protection of vulnerable groups on the labour market, workers with temporary and atypical contracts, and particularly connected to the SURE mechanism. The second area I would like to say something about is on safe and secure cross-border mobility issues and migration. Thirdly, something on COVID-19 as an occupational disease. So firstly, COVID was a challenge for many groups on our labour markets, but women were particularly hit by the effects of the pandemic, and European states have fallen back on achievements on equality achieved during the last 20 years. Women workers are overrepresented in sectors in which telework was not possible, like food service, care sector, hospitality, wholesale and retail, and I think Jan Willem mentioned more earlier. And women had to devote more time to the care needs of older persons and family members who were ill due to the overwhelmed health services. And young people commonly work in sectors and industries that were particularly vulnerable during the pandemic. And these sectors are also characterized by a large amount of part-time jobs, seasonal precarious contracts, and also undeclared work. The EU instrument SURE was probably one of the most important success stories of the fight against the pandemic. And SURE has been crucial to support job retention schemes during the COVID-19 pandemic. It contributed to the funding of short-time work and income compensation schemes. SURE also succeeded in extending coverage to self-employed, but it was not so effective to address gender gaps or other social risks because there were no guidelines to orientate the use of the SURE funds. So here is an area for improvement or a lesson to be learned. More social guidelines for future SURE initiatives. Secondly, well, mobility comes in different forms. And one of the groups most severely hit were migrants. The crisis uncovered the deplorable working and living conditions of mobile and migrant workers in Europe, with unsafe workplaces and unsanitary accommodation. And they were therefore easy targets for the virus. The situation was even more fragile considering the lack of effective coverage by social protection. And I think the intervention from Van Borren earlier echoed that insight as well. One of the advices that you had was focus on social protection systems. So here is one important lesson for the future, and that is to ensure that migrants are included in regular jobs with health and social security coverage. Another group of mobile workers that was severely challenged during the pandemic was frontier workers, workers that live in one country and works in another. And they suffered from a lack of cross-border coordination and cooperation, a lack of information, and a number of problems linked to mutual recognition. And I'm sure you have addressed these issues in this committee earlier. But this is also another lesson to be learned, how to improve cooperation between member states in times of crisis. Thirdly, COVID-19 was for a long time not dealt with as an occupational disease. However, this changed on May 18 this year, when the Tripart EU Advisory Committee on Safety and Health at Work reached an agreement on the need to recognize COVID as an occupational disease. And ETUC welcomed the agreement reached by the Advisory Committee to recognize COVID as an occupational disease that is going to provide better protection for workers in the context of the current pandemic and the increased preparedness for potential future pandemics. Because COVID-19, and this is important, COVID-19 is not only a public health issue, but very much an occupational health issue as well. And the recommendation to recognize COVID as an occupational disease will also better equip European workplaces against future pandemics. So, let me also say something on how to protect our workforce resilience for future crises. Because looking backwards at the COVID-19 crisis, in the light of the current cost of life, current cost of living crisis, we need to think more long-term about sustainable and inclusive investments. There is a need for long-term investment in quality job creation, in occupational health and safety, in active labour market policies, in education, in skills and training, and precarious jobs are not sustainable, neither economically nor socially. EU and member states must therefore focus more on the creation of climate-friendly jobs, and we also need more jobs in health, education and other public services. Shortly, we need more of Jan Willem's members. And the economic activity shrank significantly in 2020, but employment levels in the euro area fell only slightly due to the role played by job retention schemes, such as short-time work schemes that were made possible by SURE. Almost in all European countries, trade unions have negotiated agreements that achieve the triple objective of protecting businesses, maintaining employment, resuming our economies and our societies after the pandemic. And it also seems that the more involved social partners were, the faster and more successful the member states got out of the pandemic depression. In the future, instruments like SURE should be accompanied by guidelines in order to have greater social impact and to reach out to the most vulnerable groups in society. Finally, let me also mention one more success story that we seem to take for granted. We actually managed to find a vaccine. We also managed to vaccinate most of our populations. None of that would most likely been possible without joint actions at EU level. We should be happy that we had a European Union at this moment. Otherwise, we would have to invent one when we also had to deal with COVID. And however, at the same time, it's also sad that we still haven't managed to extend our solidarity to all corners of the world. And ETUC, we supported the international trade union movement's call on the European Commission to take all actions needed to make COVID-19 vaccines available for all, and to support the temporary and targeted TRIPS waiver, and also requested by the European Parliament. And ETUC regrets that the recent revelations, which shows how undue lobbying and threats regarding industry stopped a proposal that was meant to make vaccines widely available in poorer countries. And this is also a lesson to be learned. We need to vaccinate the whole world. I'll stop there.
Thank you very much for that very broad overview of the different points of view coming from both your unions. Very relevant, I think. Let me go to our speakers on behalf of political groups. Mr. Kimperopoulos, please.
Thank you again, Madam Chair, and I would like to thank also both speakers for being with us and for your very comprehensive presentations. But also I would like to thank you, Mr. Goudrian, for his mention on the mental health issue and the need of attention that we need to give in our working forces, because it's an issue that we need to see, very seriously. But I want to take another. I would like to focus on other issues. The need for recognition of the fundamental work, healthcare staff and other frontline workers. It's crucial to continue working on improving their working conditions and making their professions attractive for future generations to come. In this regard, I would like to applaud some of the government's actions in this regard, including my country, which has committed to salary increases, but also significant measures to improve work-life balance and gender equality. The Commission has also proposed a care strategy, and some of the recommendations are in the right direction, but a bit timid. Therefore, I wanted to ask you how we can increase this job's attractiveness. Secondly, as you also, Mr. Stoll, mentioned, we have the condition of, we have a new job disease regarding the long COVID. And I would like to ask you, both of you, how has it impacted your members, and what are the necessary measures to accommodate the needs of workers with long COVID symptoms? Thank you very much.
Thank you very much. Mr. Luca, please.
Thank you, Madam Chair. I would like to connect to the last point my dear colleague just raised. And when we talked with the representative of the ILO just before you came to the stage here, she said that there is no, well, quite good data on long COVID. But when you look to the scientific area, people are quite, there is a consensus that we have like at least 10% of those infected that they established long COVID. And back in September, the WHO already told us that in the European region, we are talking about 17 million people and worldwide about 145 million. So there are numbers on the table. And even though that studies are still going on, and especially as you are the representatives for the workers and the labor workforce, I would like to raise this issue again, because of course our primary goal is to have medical research and really bring a good benefit to those who are suffering from this disease, but also we can look from an economic perspective on this issue. And sometimes this helps, because if people tend to talk about money and everything, because when we talk about this high amount of people, then of course the workforce, also for the people themselves, but also to the companies, they are affected. And so this is why I'm very interested in receiving your information. Like, how do you see this whole disease? Because it's not only a wave coming up, it's already there. And how do we deal with this in the future? And if there are, especially from the trade unions perspective, if we have any recommendations how we deal with this issue in the coming future. Thank you.
Thank you very much. I give you back the floor. Can you not speak too fast, because for the interpreters, not that you did, but please be aware that the interpretation sometimes had difficulties if you speak too fast. Thanks a lot, Mr. Gouderian, and then Mr.
Thank you. Very shortly, thanks for your question, Mr. Kimpuropoulos, and referring back to the importance of addressing mental health, also with regard to the workforce and improving paying conditions for workers. I agree with you. In the European Care Strategy, it is addressed. Also, the path to how to improve paying conditions of care staff is mentioned, and that is through better collective agreements by covering workers, especially in the care sector, through a collective agreement. One of the important points of the European Care Strategy was the reference for member states to appoint a coordinator to develop the care strategy and also to report to the European Commission within the next 12 months. And we did see that as an opportunity to develop at national level, as employers and trade unions, but with governments, the strategy further. Regrettably enough, what we hear through the, how do you call that, the grapevine, is that the member states are weakening especially that part of the care strategy. So we are very concerned about that. In terms of long COVID, I think it's especially, I think the English word is galling, that for those workers in health and care who were amongst the first to contract COVID, among the first to contract long COVID, and many of them seriously, that there in many countries is no compensation available. As trade unions, we argue with member states that there needs to be compensation available because some of them are now 2 years or 2.5 years later and are losing all these social protection benefits, are losing what they used to have as wages and allowances to help them through, are losing. So it is important that at member state level, and if the European Union can help, that compensation funds are available. In general, and I think that's echoing a point Klaus Michael has addressed, it is very important that COVID-19 is addressed also as a workplace issue. And that means the full benefits of risk assessments, of discussion with the workplace representatives has to be followed.
Well, I can only echo what Jan Willem just said, and one important aspect of COVID as a long-term COVID is, of course, the connection to COVID being categorized as an occupational disease. It is a very important step towards the recognition that long-term COVID needs to have. I would also say that it's at the end of the day, it's very much about resources, having a social welfare system that can deal with it, and again, I think the SURE mechanism is a very good structure to ensure that it is possible to deal with this all over Europe and not only in those places where the resources are large. But I think I'll stop there. Thank you.
Thank you very much. Mrs. Trillet-Lenoir, s'il vous plaît.
Merci beaucoup. Merci à tous les deux.
Thank you very much indeed, both of you, Mr. Goujon and Mr. Sal. Thank you very much indeed for reminding us that the COVID pandemic, of course, had a massive impact on health service staff, and the challenges remain. They remain huge. The pandemic highlighted existing problems and has further exacerbated them. You're right, Mr. Rodriguez, to talk about the need for a health policy in Europe. We're not yet strong enough to be able to tackle these problems, but I do hear some points for hope. Thank you indeed, Mr. Sal, for having pointed out the number of lives that's been saved by vaccinations. That is, of course, self-evident, but all too often people forget that. And it's all too frequently challenged, even within the walls of this committee, by those anti-vaxxers who don't believe in it. But obviously it's critical and indeed vital for democracy that we get across these points. I'd also like to focus on the fact that it isn't just a question of prevention, it's also a question of making available more staff, which means more training. This is a huge problem. It's not the only problem, but it's a very big problem which needs to be addressed, the staffing levels. I'm glad that you are prepared to meet with DG Santé. It occurs to me that the directorate responsible for employment policy in the Commission is also a very relevant DG for you to be contacting. Maybe it would be possible even to have a meeting with the Commissioner, who hitherto hasn't been present in this committee. So really, this is indirectly, Chairman, a suggestion to you that you might perhaps take this up and see if we can get the relevant Commissioner to come along here, which would be very valuable. Then there's another positive point, Mr. Stahl, which you raised, which is the fact that COVID-19 has been recognised as an industrial disease. Now, could you perhaps expand on that? Thank you. Thank you, Veronique.
D'Amato.
Grazie, Presidente. I will speak in Italian.
Thank you very much. I'm going to speak in Italian. I would just like to ask a question. First of all, on protection of vulnerable workers in the public sector and the private sector too. So, essentially, there are large numbers of workers who are at risk because they're immunosuppressed or because they suffer from various diseases, cancer, or they're undergoing some kind of life-saving treatment. Could you tell us how many people in each member state were in this kind of category and what the member states actually did by way of response? I think my impression is to say that at the beginning, some of these people were allowed to work at home through smart working. And I don't know whether they've been allowed to continue long enough. Were they allowed to be absent without having to sacrifice days of annual leave or without being prejudiced because of being absent from the workplace and risking in the longer term even losing their jobs? So could you comment on that? And also people who needed to have face-to-face contact, like people working in supermarkets, taxi drivers, bus drivers, obviously hospital staff. All these people who had to be in contact with the people were exposed to high levels of COVID. And a lot of these people were vulnerable. Many of them lost their lives. And there is no possibility for smart working if you're a doctor or a nurse or not even much as a teacher when the schools are in class. And some of these people have found that they don't have any leave and that they're being prejudiced because they're being discriminated against, and they're running the risk even of losing their jobs, of being dismissed because they haven't been present in the workplace a sufficient number of days. So I'd be interested to hear some comments on that. Health is not a cost, it's an investment, and therefore I think we need to realise that, and everybody needs to pull together and stop cutting the health budgets, stop imposing austerity in the health sector, because that is simply taking away valuable assets. We should be removing health investment from the Stability and Growth Pact calculations so that it's ring-fenced and exempted. Could you also please comment on the way COVID has been basically weaponized in a number of countries? That includes Italy, by the way, to discriminate against workers who simply decided that they did not want to get vaccinated. They weren't even allowed to go to work for a couple of days. For example, members of parliament could come here with just a test if they did a test on with a certain frequency, but some of these workers were not able to work at all. Some of them were sacked. They obviously had no pay. Only some of them were allowed to come back. But of course, if they were able to come back, for example, to libraries or whatever, they were often demoted, or they were forced to go and work in some dark corner in order not to have contact with the staff who were working there. So could you comment on all these questions, please?
Thank you very much. Yeah, where to start? Madame Trolet-Lenard, you mentioned that there is a need for more training, more staff, more resources, and I do think you're very right. And much that happened during the COVID era or period was very much that whatever the situation was before, you find yourself having much more of it. It was also on a personal level. It could be if you were living with small kids, as I'm doing. You had an awful lot of small kids in your life. And if you were working or living by yourself, you had an awful lot of that. And if you found yourself in a workplace that didn't function very well, it suddenly became a very dysfunctional workplace. And I do think that what we see now is much clearer things that are problems on the labor market, and training, resources, and more stuff is certainly things that needs to be addressed. COVID as an occupational disease, well, it essentially means that the recommendation for member states is that it is an occupational disease, that you are qualified to, just as you would have other diseases happening to you coming from work. So it has to go through the national laws and so on, but the recommendation now is clear. It is an occupational disease. On Amato, I'm not sure what to say. The last thing you mentioned is the question of discrimination, and I think if you've chosen not to vaccinate yourself, it's a tricky issue because, of course, as an employer, you are responsible for the health and safety of the people that are working there, and if you can't guarantee it, because someone chooses not to vaccinate themselves, well, then you have a problem as an employer, and I think that's where you get into a lot of difficult discussions, and I'm not sure this is the time and the moment to get into that, but I think I'll stop there and let Jan Willem continue.
Thank you for the various questions and for the positive feedback as well. You're right, of course, Madame Trillet-Lenoir, that the pandemic exacerbated, put in more focus the staff shortages, which were indeed pre-existing and which, as you were saying earlier, are continuing. But it is a crisis in Europe now. The lack of staff for health and for care, it is a crisis. I mean, if we don't address that, we will lack care. And of course, referring back to the earlier question, how to address this is an issue of funding. You mentioned, Mrs. Amato, the issue of austerity and to take out health and care finance from the European economic governance rules and to ensure that there is investment and funding, public funding for that. And of course, we do agree with that. It's strengthening our social protection, strengthening our public services because they are the backbone of our societies. For addressing the issue of protection of vulnerable workers, also here it is important that there are collective agreements which ensure that workers are covered by protection in the workplace. A collective agreement can give. And one measure which could be taken, which has been addressed in this House, is to make that also part of public procurement rules. The need, if you have a public contract, to have a collective agreement. Klaus Meijko already reacted to the very difficult question of vaccination. And we have been in favor of vaccination, of voluntary vaccination. We have indeed seen that the whole issue became weaponized. I think you coming from Italy will know that the head office of one of our unions in Italy a year ago, a little bit more than a year ago, was attacked by people who split off during an anti-vax demonstration. So that is not, I think, the way we want to go. And indeed, that you could say COVID-19 was weaponized. And I was present about, almost a year in the beginning of October at the opening of the offices of our trade union colleagues, and that was a very sad moment to see. So we have also supported the campaigns, I think also supported in this House, of addressing misinformation, disinformation around those questions. And I think it is very important to provide correct information to people. The other issues have been addressed by Klaus Michael. It is an issue of addressing at the workplace through the health and safety measures we can take there. A last point on this. It is a complicated question, as you mentioned. You have to balance lots of issues with, as you mentioned, the right to health. And also the European Court of Human Rights actually expressed itself on this issue, which I think has also been acknowledged in this House. So.
It is absolutely a very delicate balance that you have to seek. And I also think it's very important in the light of future pandemics, although we hope there will not be, that we do reflect. Yeah, but we need to be prepared. That's what this committee is all about. So, Mrs. de la Pisa.
Bueno, pues hoy se ha hablado mucho de.
So, thank you very much. Thank you very much to our guests today. I will be speaking in Spanish. Today we've talked a lot about doctors. And a lot of the testimonials of doctors have been very overwhelming. They've talked about how they've had to protect themselves using plastic bags because they didn't have access to PPE. So, in trade unions, what can be done when you're facing a situation like that? It was seen as normal for doctors to work without the right kind of protection. And so perhaps people who don't work in the health sector might not understand it, but it's almost like someone who works on a building site to work without protective equipment or a harness, for example. And so that increases the risk of the spread of COVID in those circumstances, and the consequences of that have been quite significant. Perhaps the shortage of doctors, which we had already seen before the pandemic, has been worsened because of those conditions that they had to face. I have a lot of contact with doctors, and they often talk about PTSD. It goes much further than burnout. These are people who are affected in the long term, and they're very committed to their vocation. They want to go back to work, but they don't feel able to. I'm talking about people who tremble at the thought of going back to hospital. There are some healthcare professionals who have had to face very dramatic circumstances, and they haven't really been able to process that. So what initiatives do we have for these doctors who were on the front line? And in fact, a lot of doctors had to work in care homes alone, and that was very difficult for them as well. This is a situation that we have seen developing over time, and it's come to a head right now. We've seen how doctors have been subject to a great deal of pressure because they have had to run their clinics in a very strict way. And so where is that freedom for them to decide? They only have 5 minutes to talk with their patients. There are a series of very strict protocols in place. No one can ask questions. So doctors with a real vocation will know that this can be very restrictive for them. We're seeing this with vaccines as well. We're not allowed to ask questions about vaccines. We can't question the possibility that perhaps vaccines aren't always the best option, because we're just seeing in hospitals how doctors are wanting to do the best for their patients, but they have to follow a very strict protocol that is enforced in hospitals. And if they don't, then they are marginalized by their bosses or by their colleagues. So what's the impact on hospitals?
Thank you very much, Mrs. de la Pisa. Mrs. Matias, please.
Muito obrigada.
Thank you very much. I'd also like to thank the guests here today and thank you for your presentations. You also highlighted some very crucial issues, and they're often neglected. You talked about the feminisation of domestic care work in general. And I think this happens in all our countries. We recently had a mission to Italy, and we saw that. We saw how care centres, care homes were predominantly staffed by women, and domestic workers are generally women as well. And that means that this kind of work is undervalued often. And not only in terms of salary, but in terms of recognition. And so I wanted to ask about how we can continue to insist on women having that recognition in terms of their salary and being acknowledged in that kind of work. I'm also glad that you talked about the role of trade unions. I think during the pandemic, that has really highlighted the importance of trade unions, and we're seeing now how important it is in Europe to reinforce the role of trade unions during the crises. And you also talked about how many workers on the front line during the pandemic had to face very precarious circumstances, and they weren't protected in their workplace. And we know that these precarious circumstances and this lack of protection dates back quite a long way. It didn't just happen during the pandemic, but the pandemic made the situation a lot worse, and a very high number of workers lacked protection. And so my question for both of you is that, given that we understand now the situation regarding precarious work, flexible work, and a lack of protection, what structural measures do we need to develop and take into account so we don't face a similar situation to this in the future, where employment has become so fragile? Thank you.
Mr. Staal.
Yes, thank you. Thank you very much. I think in terms of preventing, starting with Mrs. Matthias, and thank you for your positive comments again. Starting with your question of how do we prevent that workers are not valued, the women who deliver health and care are not valued enough. I think that is what I started off by addressing. That needs also a collective response of us. It's not just the situation of one hospital or one care home. It needs a collective response and a collective approach, starting with the recognition of the work they do and the value of their work. And that means also, when we talk about public budgets, it means financing for those services. I think I mentioned that one of the fact that there is still, that tomorrow we celebrate equal pay day, or I should maybe say unequal pay day, a large part of the inequality in pay or the lack of women catching up is due to the fact that in care women are not, the work of women is not valued appropriately. And that also means recognizing the role of the trade unions, the instruments of trade unions with employers and in discussion with the governments. I mentioned it before, collective agreements. Klaus Michael mentioned social dialogue, workplace representation. That's also partly a response to Mrs. Margarita de la Pisa Carrion. I hope I pronounced that correctly. When you talked about doctors, first I would say it's not only about doctors. We talk about a one-team approach. The doctor, the nurse, up until the cleaner, often women, who also has to ensure that the hospital or the care home is clean. That is as important for many of them. They saw some people in the workplace getting full protection, but others themselves not. Whereas the virus was circulating, etc., in their workplace. So certainly, I think one of the measures now in the European Union which is addressed is having storage of personal protective equipment, so that we are better prepared. We were not prepared. I mean, I think we have to face that. Ensuring that there is training and better training protocols, safety protocols which are available, and also discussing that with the unions. I can only agree with you that, and we heard that in the testimony we had in that meeting here in the European Parliament, the dedication of the health and care workers in those difficult moments was phenomenal, no? I mean, they knew they were going to be exposed, and still they came back to their place of work to help the people they had to take care of. And I think I started by acknowledging that, and I do that here again. You mentioned many workers, doctors, but also nurses and other staff suffering from PSTD, post-traumatic stress disorder. That is true. And many of those workers feel exhausted. I mean, they're completely knackered, if that's English, in what they do. They have to catch up. They cannot provide the care they would like to provide. And that's why many leave. I mean, we did research, and about 420,000 workers have left the sector in 2020, 2021. I mean, 420,000 people who left a sector which already had staff shortages, as we also heard. So I think we need a collective response to that, and I hope that's one of the conclusions of this committee, to value that work. It is addressed in the European Care Strategy, but we have to go further in doing that. And I hope they haven't watered down, the ministers haven't watered down the care strategy, the long-term, the recommendation on long-term care. I hope they haven't watered it down.
We hope the same. Mr. Staal.
Thank you. Yeah, thank you, Madam Matthias, for lifting the workers on the front line. And I think one of the early insights were just how the change of understanding what is important work, because it turned out that the work that was most undervalued, I would say, turned out to be the most essential work that was needed to be done in order to make our society hold together during this period. I think that was a wake-up call in many ways. And I forgot to mention the tight labor issues that we're dealing with right now, which so well illustrates the situation that many conditions, in many places, the work was not paid enough, bad conditions, bad in terms of safety, and many other things. And I do think that these are the things that we need to address in the future. How we make our jobs safer, how we get better wages, how we get more resources to our workplaces, and simply create better conditions for work. And then to Madame de la Pisa, well, I'm not an expert in hospital care and so on. I think Mr. Gudrian, my colleague, addressed some of the issues, but I do find it a bit provoking when you talk about doctors only in this case, because I will tell you that my mother is a nurse, and she almost died in COVID during this period. So it's a bit insulting the way that you're framing it, talking only about doctors. And I would strongly advise you not to do that again. Having said that, it's very much about the resources. It's about creating conditions that makes the staff able to do the work they're set to do, and that was lacking definitely in the beginning of the COVID era. So I'll stop there.
Thank you very much. For the last round of speakers, I have on my list Mrs. Olson, Mr. Orville, Madame Rivasi. Anybody else? Meneer Roos? Yeah, you're on my list, Miss. Yeah, Mrs. Olson, please.
Thank you, Madam Chair. I will continue in Swedish. Jag vill börja med att tacka våra inbjudna talare.
So thank you very much. First of all, I'd like to thank our speakers. You did address some very relevant issues. You spoke about what happened in the past and you spoke about the future. I'd like to talk about the situation of women on the labour market. Even before the pandemic, there were many studies that showed that women's working conditions were particularly difficult, particularly in sectors where there are many women working, like in the health sector. And with the pandemic, the situation got worse. The working conditions, labour conditions, particularly for women as well. And they were in the front line often. They were in direct contact with the virus, so they had to go to work nonetheless. And then there is an exhibition, in fact, that highlighted this. So it's very difficult for women, and there's a lot of inequality. There's a pay gap between the men and women. There's no real work-life balance either. So a question for both of you. You did touch on it, but let me come back to it. So what lessons can we learn from the pandemic? How can we ensure that these situations don't arise again in future? And then, we need a good social dialogue. We need an agreement, a collective agreement. We need to ensure that what we have in place is right, and what has happened with the social dialogue as a result of the pandemic, and how can we improve the situation in future in relation to all this? Thank you.
Merci, Madame la Présidente.
Thank you very much. I shall be speaking French as a speaker. So, the COVID-19 pandemic really was a massive upheaval for workers. Many workers had to stay at home. Others had to go into work despite the health risks of that. Now, public health services were very badly hit by this. So you represent public services, and what has been the result of the pandemic in terms of the protocols that are needed in the health sector? Many difficulties were encountered with decision making. Social partners weren't always involved, didn't always participate. Were you consulted when it came to introduction of protocols and as to when they should be lifted at the end of the pandemic? And in terms of lessons learned, do you think that public services are now well prepared for future crises on a similar scale? Thank you.
Merci beaucoup, Madame Rivasi.
Thank you very much, Mrs. Rivasi.
Merci, Madame la.
Thank you very much, Chair, and I'd like to thank the trade unions for being here as well. I'd like to talk about the staff who were dismissed or who saw their contracts suspended because they refused to vaccinate. 130,000 workers in France, all different categories. And at European level, I've seen that some countries like Italy and Greece are wondering as to whether the staff should be rehired. In America, there have been some court cases asking for them to be reintegrated with compensation. In Canada as well. So my question for you is, what did you do to defend workers' rights and their dignity? Because it's not a case of whether they're in favour or not of vaccinations. You should be defending employees, workers. And the workers had nothing. They had no wages and no compensation, no access to unemployment benefit. I've met these people and they had nothing. And, I think that's they were mistreated. They really were. That's my opinion. So what would you recommend in terms of these workers who were dismissed or had their contracts suspended? And what would you do if there were a new pandemic to ensure that these workers were recognized, had better working conditions? Because, you know, when you have a pandemic, it's not just about vaccinating people. It's about having staff to look after patients, to do the diagnosis and so on. And I think that your role is very important in all that. So what would be your recommendations in the case of these people who've been suspended for work, and how would you improve the working conditions and living conditions of these workers? You know, we used to clap them, didn't we, every evening, and then they suffered discrimination. Thank you very much. Mr. Nero.
Thank you, Madam Chair. I have a question, and it's in addition to the question of Mrs. Revesi. Many unvaxxed workers were discriminated in European countries, especially in the healthcare sector, but in some countries more broadly. Now we do know this was a mistake. The inoculation does not stop the COVID transmission. Governments and companies were wrong to exclude these people. We must learn from that, and it should never happen again. In that perspective, do you think it would be good for the employers and governments to issue an apology for discriminating against these workers? Thank you very much.
And the last for this hearing, part of the hearing, Ms. Kutayar, and then you have final.
Thank you much, Chair, and thanks for our speakers for being here with us today. Sorry for not being able to follow the first part of the presentation, but I was stuck in votes in another committee. But I wanted to bring also this question and contribution to today's discussion. Frontliners are in the healthcare sectors, but we also had frontliners in the transport sector. And here, for example, I would like to refer to the seafarers who were facing precarious situations with different realities. Some were stuck at home, unable to provide for their families and go to work, but others were stuck at sea, on ships, sometimes even beyond the end of their original contracts and unable to be repatriated due to COVID-related restrictions. Then we had also other workers involved in the supply chain of essential goods, especially truck drivers, for example, were faced with a very difficult situation during lockdowns, with all facilities to rest, eat, or most of them at least, being closed, and therefore this impacted their work. And therefore I wanted to refer specifically to these essential transport workers who are very much important too, because on transport we depend for imports and exports and for essential food and supplies. And my question here is, what should be done at an EU level from your perspective to ensure that such a situation will not repeat itself during another pandemic or another crisis? Because after all, this committee relates to learning COVID lessons, but this applies not only to other pandemics, but also to other shocks and crises within our system, and how we make our socio-economic aspect resilient. Thank you.
Absolutely. How important the care workers were. They were absolutely key, but also the other workers had huge effects. But since a lot of questions went about healthcare, I start with you, Mr. Gouderian, and then Mr. Staal, you can answer on the other questions. And the floor is final answers.
Thank you. I think I'm trying to order a little bit the questions. Mrs. Olsen, for your question about women on the labour market, the continued existence of the pay gap, the importance of work-life balance, and the lessons we can draw from the pandemic. I think there are currently a number of measures in discussion, also around the gender pay gap, which rapidly need to be adopted, even improved on the proposal of the European Commission, I would say. I already addressed the issue of social dialogue and collective agreements, which I also think is an answer to the question of Mrs. Rivasi. I think I appreciate that you acknowledge the important role of trade unions and workplace representatives to address this question also of discrimination at the workplace. And many of my colleagues had to deal with all these questions, as Klaus Michael also say. That's why we don't have a position on mandatory vaccination. All the situations are a bit different. What is important, though, is the role of discussions at the workplace between the employer, between the trade union, between the workplace representatives, often the health and safety committees at the workplace to address those issues. And that obviously also implies for the aftermath of what happens with workers who feel discriminated against them. And I hope they also turn to the unions to discuss those things. In terms of the question of Mr. Orville, thank you for stressing the role of public services, le service public. And again there, I fully agree with you that it is important that the social partners are involved in all those discussions, that trade unions, but also our employers, are part of the discussions we have with governments, and to be well prepared. I think that is a recommendation possibly this committee could do. To be well prepared is for employers and trade unions to go through their protocols, how to address those situations. In many cases they are now there, but are they bulletproof? Are they covering all the situations? And for public services themselves, I think it is an issue of funding, as we do know. I mean, many public services have been underfunded, and it is important that we value them as well as our social protection systems for the future. And again, I hope that is a recommendation of this committee to invest in our social protection and invest in our public services, including in health and care. And that, I think, you will address some of the other questions. But it also applies to urban transport, to our public transport systems, for example.
And I'll try to continue here. Yeah, so for Carina Olsson, you really put the finger on something that is important, and that is that we don't lose track of good developments that we had before the crisis, and that we don't fall back in the way that the women's rights become less important, or that inequality goes up instead of down. And I think that many of the things that I'm saying now will also connect to the question you raised on seafarers and truck drivers and so on. And it is very much about making, first of all, awareness of the situation, but secondly, also ensure that there are resources to deal with the issues. And thirdly, to ensure that we have rules that are properly addressing the issues that we want to achieve. And fourthly, and that connects to Mr. Always' issue on consultation, I think there is also a great importance, which also connects to what Madame Rivasi is mentioning, is to involve social partners, to involve trade unions at all levels and in all situations. Because one of the things that I do think one can looking backwards, you live life forward, you understand it backwards, but looking backward, I do think that where the social partners were involved in the measures that were taken, they were more successful in the long run. So more social partners, and just as Jan Willem said, I think that's an important conclusion that we hope to see from this committee, is that it is useful. And then, yeah, I think I'll stop there.
I am sorry, but vous êtes trop vague. I am sorry, but vous ne répondez pas.
I'm sorry, you're being too vague. You're not answering the question.
Mrs. Rivasi, in the sense that the situation is very different in different member states. It's not like there's one policy. I do remember the situation in the country I know best. At a certain moment of time, there was a discussion about obligatory vaccination in the healthcare sector. Then it didn't went through, and it was like a lot of evaluations. And what I think is important, as I said before. And also for us to reflect when we write a report, when we all will discuss the report, is how do we look at the future? And also for the unions, how to assess looking at the future when it comes to, there will be situations in the future. We don't know exactly what it will be. Will it be about vaccination or other medicines, or we don't know, but it is something completely new to reflect upon, and I think we need to take that back. Yes, if you want to. I have to conclude this hearing.
One thing we will do is look at what we have said on vaccination schemes, and if we have a position, send it to you, so that you are better informed. I think I did not respond to the question of the gentleman behind you with regard to the Mr. Roos, with regard to the question if employers and government should apologize to workers. I mean, maybe that's something to reflect on. I would say, let's think of a European day in which we remember the work which has been done by so many people during the pandemic. A real European day of remembrance, which I think I would say is more of a priority here. But that's obviously a point for further reflection, as I think you also mentioned in other questions, no?
Okay, we'll come back to that. Now we have the employers, so you can raise these questions as well to the employers. But thanks a lot for being there. I think it was a very interesting hearing, very open-minded, a lot of questions, and you gave us a lot of proposals for recommendations to put in our report, and so we will for sure reflect upon them. Thank you very much, Mr. Gouderian and Mr. Saal. And I invite the employers' organizations to come to the front.
And thanks for the members of taking the time to be in discussion with us. No? Thank you.
Okay, dear colleagues, I know it's very intensive all, having like... I always like to do that. I always like to do that. Mrs. Rivasi, you're the vice chair of this committee. Huh? Okay, so let's proceed. It's very intensive. We started at 3. We're at the last set of hearings, the last of the 3 hearings that we had today, with the representatives of the employers. First of all, I'd like to welcome Mrs. Christina Soder Haslund, Health and Safety Manager, Confederation of the Danish Employers Federation, I guess, so, yeah, and Mrs. Veronique Willems of the Secretariat General of SME United.